So the journey started for the practice a couple of years ago. We started care navigating quite early on, but obviously over time the amount of things that the pharmacies can do and the things that they can treat has developed.
We were early adopters of it. We were very keen to streamline our processes so that patients were seen in the right place at the right time and were taking responsibility for their own health.
The first time I became aware of the Pharmacy First it was brought to us by the administration team. It was discussed at a GP meeting with all the GPs present to see whether it was something that we felt we would benefit from as a practice and also for the patients, and we felt that it was definitely something that would enable us to concentrate on the more complicated patients who needed to be seen by a GP.
As a pharmacist that's worked in community pharmacy, I could see the benefits of encouraging this relationship with the local pharmacies and getting that to work, and how it would benefit all of us professionally to encourage the service.
When we first started referring to the pharmacies, I think the patients were a little bit apprehensive. So for us, we tried to educate the patients as much as possible and let them know that it was a referral to a clinically trained pharmacist, that they would have a consultation with the pharmacist. And as time's gone on, patients have become more accepting of that, and they don't really question it now if we say it's something suitable.
So at the surgery, we use System 1. And we have an icon for the PharmRefer, which we can click onto once we've loaded the patient's records and send a referral along to the pharmacy. It only takes a couple of minutes once we've got the details from the patient, as it links to their NHS account. So once that referral's gone through, the pharmacy will access everything from there.
The Pharmacy First is led by the reception team. We've done a lot of training in the care navigation and the Pharmacy First in particular. If the patient doesn't want to be referred for Pharmacy First, they are able to speak to a nurse practitioner or a GP. But what we have found over the period that we've been doing Pharmacy First is that the patients have adapted. They are happy with Pharmacy First, and it is working well for the practice.
The patients tend to ring up usually at 8 o'clock on a morning, and depending obviously what their symptoms are, the receptionist would triage that and decide whether they were suitable for a referral to the pharmacy. However, we also do have e-consultations at the practice. So again, when they're getting processed, the reception team look at the symptoms that are on the e-consultations, and if it's appropriate for the pharmacy, they would contact the patient for their consent and then send a referral if they agree to it.
So once the patient's been seen by the pharmacy, we get a letter back. They normally come through on an email to us with the information from the consultation that they've had. So it'll have the details of the problem, what was discussed with the patient, and if they were given any treatment. If there was any recommendations for the GP that they want to follow us up, or if they were signposted elsewhere, it'll also have them actions on there as well.
The practice's relationship with the pharmacies, it seems to be working quite well. We send our referrals to them. If there was anything that they felt was inappropriate or not suitable for PharmRefer, they've got our direct dial to my desk, the office supervisor desk, or they can send a rejection via email, and we would pick that up on a daily basis and then navigate elsewhere, probably usually to the GP.
The main benefit that we found as a practice is we feel that it's improved capacity for other patients. It's also enabled the simple urinary tract infections to be treated appropriately elsewhere. And as a GP, it's enabled me to just concentrate on those patients that I really feel do need to be seen by a GP that otherwise might be missing out on an appointment.
If you're thinking about using Pharmacy First, I would definitely encourage it. The benefits have been huge for the doctors, the receptionists, for the patients. It's developed clear pathways and provided a much better service.